Hello and welcome to Nature Source Care. My name is Dr. Funda Goldman. I'm a licensed naturopathic physician. And in today's talk, I was going to talk about Marma Therapy, the Ayurvedic energy points on the thigh. So let's go ahead. Just a note of caution beforehand. The information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. It is always important to determine the root cause of any disease and to develop a comprehensive treatment plan, of which Marma Therapy can be a part. Individual cases can vary in terms of treatments that are most effective, and solo therapies, such as doing Marma Therapy by itself, may not be appropriate or effective in all cases. So please keep that in mind as we go through. Just a few words about Marma Therapy generally. It comes from Ayurveda, which is traditional Indian medicine. Ayurveda is more than 5,000 years old. I really appreciate Marma Therapy because it's a non-invasive therapy. It is an energy therapy, so you kind of have to wrap your mind around that kind of a different paradigm where instead of being a biomechanical or biochemical process, you want to start kind of thinking about people, diseases, states of health as energies or waves. And there are 117 Marma points on the body. So if you've been following me with my other videos, I think I wrote down 107, which since we're getting to the end here, it looks like maybe I miscounted somewhere along the way. So as far as I know, it's 117, but double check my math on that. So the important thing with Marma Therapy is that basically you're just using touch to allow the energies at these different points to rebalance themselves. It's actually a very simple concept. So if you're interested in more history on Marma Therapy, I would check out my very first video on Marma points on the hand. You'll get some more history there. If you're interested in an example of Marma Therapy, I also created a Marma points on the hand follow along video. So you can go ahead and check that out and just follow along and give yourself a Marma Therapy treatment on the hands and see how that goes. As far as this video, we're going to be talking about points on the thigh, and a lot of the points here are actually similar, or there's some overlap with Marma points on the lower abdomens and also the lower back. So you might check out those videos to kind of see other points you might use for the things that are indicated by these points here. And if you're interested in this content generally, you might check out my playlists, Marma Therapy, Ayurveda, and Body Care. I'm pretty good at organizing my videos into playlists so that they're easy to find. So let's start with the points today. We're doing 6. And they're kind of, it's kind of funny once you get to the legs, like they start to kind of lump them in pairs, which aren't actually immediately obvious. So let's just go through. So the first one is a single point. It's called Spij. That translates to gluteal fold in Sanskrit. And it's located on the midpoint of the transverse gluteal crease. So basically the kind of crease underneath your tush, your buttocks there. That's the gluteal crease, and so right at the midpoint of that, and you have one on either side, so there are 2 speech points, one on the left, one on the right. The energies balanced by this point are the Vyana Vayu and the Apana Vayu. These terms may not mean much to you unless you're a deeper student of Ayurveda. Excuse me. So Vayu means wind, and so Vyana Vayu is actually the wind that generates circulation through the heart, like your peripheral circulation, your cardiovascular circulation. So in any case, I wouldn't worry about it too much, but if you are a deeper student of Ayurveda, that'll help you kind of organize these points and understand like what kind of energies they're generating. Okay. In any case, speech, as all Marma points do, has local effects. So if you work on this point, you can help to enhance circulation in the lower extremity. You can help pain in the area, so pain from the gluteal region, the coccyx, the low back, sacrum, because again, this point is close to those areas. Also, lumbar sacral radiculopathy, also known as sciatica, can be helped at this point, and neuropathy running down the leg. It can also be helpful with issues related to the colon, especially the sphygmoid colon and the rectum, so the last part of the colon, since it's obviously very close to that. And then if you work on the right point, that can help with the problems with the ascending colon, and if you work on the left point, that can help with problems in the descending colon. So this is a fairly simple point, but helpful nonetheless. Okay, so here's our first pair of points. They're both called Shakti Urvi, or power of the thighs, as it translates into Sanskrit. And then you're gonna have one on the posterior leg side of the leg, and you're gonna have one on the anterior side of the leg, and then you're gonna have one posterior and anterior on the left, and one posterior and anterior on the right. So you have 4 total Shakti Urvi points. Okay, so try not to get confused. So where are they located? So the posterior point is 1 or 2 anguli, which is like a finger's width, superior to the midpoint of the line between sphige, which we just covered, and posterior janu. We have not covered posterior janu. I'll have to do that in the next video on the knee. Janu means knee. But basically, posterior janu is at the center of the popliteal crease. So that line in the back of your knee, that's the popliteal crease. So if you go right in the middle there, that's posterior janu. So if you draw lines from sphige, which is the midpoint of the gluteal crease, and you go straight down to the popliteal crease, this posterior Shakti Urvi point is not exactly midway. It's a finger or 2 higher or superior to the midpoint. All right. The anterior point is at the mid-level thigh on the quadriceps. So that one is in the middle. So if you draw a crease from the sort of like the inguinal fold, and you go down to the center of the kneecap, and then you go halfway between those 2 points, that's your anterior point. So the posterior point is not quite midway, it's just a little bit, 1 or 2 finger widths above the midpoint on the back of the leg. All right, so you have these 2 points now. The energies balanced by these points are the Udana Vayu, the Vyana Vayu, and the Upana Vayu. And again, you don't really need to get too caught up with these terms, but they can be helpful. Again, local indications. All Marma points have local indications. So, when in doubt, not sure which points to start with. Start with things that are close to wherever the problem is. So again, improving circulation in the lower extremities. So peripheral vascular disease, edema, swelling in the lower leg, pain, like in the low back, also arthritis in the hip and the knee, neuropathy. And then the posterior point is also good for sciatica. Not the anterior point so much, but the posterior point, yes. These points are also helpful with issues in the kidneys and bladder, so things like renal colic, cystitis, urinary incontinence. They're both also helpful with the colon again. And these points can also be helpful with issues with the ovaries and testicles, such as sexual dysfunction, issues with libido, impotence, and pain with these tissues. These points, the Shakti Urvi points, also help to boost energy. So this is related to Udana Vayu, mentioned up above. Udana Vayu is the movement, any sort of upward movement in the body. So if you're feeling sluggish and you're feeling down and you're feeling like you're kind of stuck to the earth, if you need a little boost and you need to draw the energy up, you can stimulate these points. You can even just do a few little knee bends or squats or something like that. That'll stimulate these points, and that'll get your energy moving up and out. So again, there's some sidedness here. So the points on the right side are helpful with the ascending colon, and the points on the left side are helpful with the descending colon. All right, so there are your points 2 and 3, Shakti Urvi, anterior and posterior. Alright, so our 4th point here is called Lohitaksha, which translates to vision of the blood. It kind of sounds like lohita. Lohita is on the hip bone, anterior sacroiliac spine there. It sounds like it, but that one's lohita. This is lohitaksha, so try not to get them confused. In any case, the location of this is the midpoint of the inguinal ligament on the anterior thigh. So you kind of drop down from the inguinal crease a little bit, and you go a little bit inwards, okay? And that's where this point is. So it's kind of in the top third of the thigh. The energies balanced by this point are the Vyana Vayu, the Apana Vayu, the Ranjika Pitta, and the Shleshika Kapha. So again, you don't really need to get too hung up on these, but just as an example, Shleshika Kapha, Kapha is earth energy, and Shleshika Kapha is specifically the lubrication of joints. So you can imagine, as we'll see in the list of indications here, is that this point is good for things like arthritis and lubricating the joints, like the hip joint and the joint and stuff like that. In any case, this point is also good for circulation of the lower extremities, so peripheral vascular disease, blood flow, edema, swelling, pain, sciatica, neuropathy, and as I mentioned, arthritis of the hip, because it helps with lubrication of the hip. This point is also unusual of the 4 thigh points because it helps with the heart. So things like high blood pressure and cardiac dysfunction can be helped here, which might seem a bit odd. But the thing is, right in this area, it's very close to the femoral artery, vein, and nerve, which all support cardiac rhythm and function. Okay. This point also good for the colon, especially flatulence, if that's an issue. This point is also good for helping the ovaries and testicles. And this point is actually used to test the male cremaster muscle, which is a muscle that actually shifts the position of the testicles. So if somebody is paralyzed, for example, you can use this point to test to see the likelihood of function returning. Yeah. And again, we have sidedness here. So the right points, lohitaksha on the right leg will be helpful with the ascending colon, and lohitaksha on the left leg will be helpful with the descending colon. All right, so there you go. Fourth point on the thigh. And then the last pair we have here, 5 and 6, are the urus, which translates to origin of the thigh. And these are located on the lateral aspect of the thigh, so basically down the the IT band, iliotibial band, on the side of the leg. So there's Uru 1, which is near the hip, Uru 2, which is sort of about halfway down the leg, and then you have both of these points on each side. So this is going to be 4 total points here. All right, so if we look at the picture, Uru 1, you can see the little 5 in the parentheses on the side of the hip where the greater trochanter is. This is where your femur basically connects to your pelvis. So this is Uru 1. Uru 2, so this is a little bit subjective in terms of the description because everybody has different lengths of arms compared to their legs and their torso. But generally speaking, if the patient stands up with their arms at their side, where the middle finger touches the side of the leg, this is Uru 2. It's also about 9 anguli or finger widths above, superior to the popliteal fossa. The popliteal fossa is the line and the back of the knee. All right, so you got Uru 1 right on the hip bone there, right at where the hip or the leg connects to the pelvis, and then Uru 2 sort of halfway down the side of the leg. The energies balanced by these points are the Vyana Vayu, the Apana Vayu, and the Shleshika Kapha. Indications, once again, local. It enhances lower extremity circulation, edema, pain, sciatica, hip and knee pain, and arthritis, dryness, and inflammation, because again, this is another point. These are other points that stimulate Shleshika Kapha, or the lubrication of joints, and neuropathy. These points are also good for the colon, especially constipation. They're also helpful with genital issues such as any sort of disorder, really, and libido. And these points, unlike the other point that was good for Udana Vayu, which is an upward movement of wind, these points are good with Apana Vayu, or downward movement. So anything that requires downward movement, such as menses, all right, such as urination, such as defecation, such as ejaculation, with all these fluids like coming out of the lower part of your body, that's basically all Apana Vayu. And so if there are issues with any of these, you can use these points to help with that. And again, Uru 1, the one right where the leg connects with the pelvis, this is going to be more helpful with hip issues. And Uru 2, which is halfway down the leg, closer to the knee, it's going to be more helpful with knee issues. And again, we have sidedness here. So the right side, the points Uru 1 and Uru 2 on the right leg are going to be more helpful with the ileocecal valve. So again, that's part of the ascending colon. And on the left leg, these points, Uru 1 and Uru 2, are going to be more helpful with the sigmoid colon, which is, again, part of the descending colon. All right. So let's summarize here. It's a little bit tricky because it's not exactly straightforward the way these are all kind of laid out, like the names of them and stuff like that. But, they're fairly simple. There's a lot of overlap with these thigh points. So all of them good for local effects, pain, swelling, circulation, edema, we've talked about that. All of them are also good with the colon. If you want to help the ascending colon, work on the right leg. If you want to work on the descending colon, work on the left leg more. Points 2 and 3, the Shakti Urvi points, those are helpful with the kidneys and bladder as well. All of these points, Svij, really the information I had is that Svij was not listed as a point that's helpful with the ovaries and testicles, but it's pretty close. It's hard to imagine it wouldn't have some effect, but technically speaking, all of the points except Svij are helpful with ovaries and testicles. The Urvi Shakti points, anterior and posterior points 2 and 3, are helpful with increasing energy in the body because, again, it's that upward Udana Vayu movement that they're helpful with. Point 4, Lohitaksha, right? That was an unusual point. That's helpful. That can be helpful with heart issues. And then Apana Vayu, the downward movement, again, Uru 1 and Uru 2 on the side of the leg. All right, so there you go. Those are their thigh points. So how do you work with these points? Again, you can just gently press these points with your fingers, and you can check out my Marma hands follow along video if you want an example of that. You can use warm or cool packs. This, though, really depends. You have to know from an Ayurvedic perspective if the issues that you're dealing with are Vata, Pitta, or Kapha. Vata meaning wind, Pitta meaning fire, Kapha meaning earth, because Vata and Kapha are cool, and so to balance them, you need to warm them up. And Pitta, on the other hand, is a fiery energy, so generally you want to cool that down. So if you're not into Ayurveda to that extent, or don't know how to figure out Vata, Pitta, Kapha, don't worry about it. There are other ways of working these points, so just move on to the next one. For example, Abhyanga, which is a warm oil massage, that's very helpful with stimulating all the Marma points. And if you want to choose a specific oil, I would look at my video, Natural Oils for Body Care, to get into different energetics of oils from an Ayurvedic perspective. You can always use meditation and breathing. Just simply meditate on these points and send your breath, think about sending your breath to these points, because these points are energy points. So by sending your prana, your life energy, to these points, it will help stimulate and rebalance these points. Also different yoga poses. So pretty much anything that's going to utilize the leg muscles or stretch the leg muscles, so things like forward bend, whether you're standing or sitting, Uttanasana, Paschimottanasana, chair pose, upward dog, downward dog, because again you're stretching either the back of the legs or the front of the legs. Hero pose, because you're sitting on your heels, your knees are bent, so you're stretching right? Your quadriceps, but you're also sitting on your hamstrings and your sphege point. So, you know, a lot of the points are stimulated that way. Child's pose, basically, it's sort of like hero's pose, except that you're bent forward, but you're still stimulating the points on the thighs. You know, if you stand up and cross your legs, and then bend to the side, you can start to stretch. I think it's a little harder to stretch those uru points because they're on the side of the leg. And if you're a runner or cyclist like that, you can actually get what's called iliotibial band syndrome and start getting a lot of tension, tightness, pain there, and then it translates in the kneecap typically. So doing something like you stand up, just cross one foot in front of the other, and do a gentle stretch to the side, or bend sideways to just stretch this side band here, or the uru points, that can be helpful. Lying on your side, actually, you don't even have to like stretch, especially if it's very painful or tender. Sometimes lying on your side might work, although, you know, if you're lying on a hardwood floor and you have a lot of pain there, that might not be comfortable either. And also something like locust pose, where you're grabbing you don't always have to grab your heels, but sometimes if you grab your heels and then kind of, you're basically doing back bend, you're on your stomach, and then you do a little back bend and lift up your chest and lift up your legs, and you can reach back and grab your heels and pull up even more. Those sorts of things. I mean, basically you're going to be contracting the sphege point, right, and the hamstrings and the quadriceps, and you could even do something like bridge pose. That's another way to stimulate these points. So lots of ways to stimulate the thigh points to help you with different issues. Okie doke, so there we go, 6 more points on the thighs to add to our repertoire. We're getting close to the end here, folks. I guess all we have left are the points on the knee and then the points on the foot. So it looks like we have 2 more videos related to the points of Marma to complete the set. And then I'll be doing other videos to support knowledge and use of the points in sort of practical circumstances. Alright, so I hope you found this helpful. Keep working on your points for yourself, and every time you need something and start working with these points, you get to learn them a little bit better. But again, you got to keep this in context with everything else. You know, all your other modalities. I mean, nutrition is always important, herbal medicine, you know, and sometimes rest. You can overdo it, you know, sometimes, especially if there's a vata issue, a lot of, you know, excess movement, anxiety, stress. Sometimes the best thing to do is just rest rather than like start poking around. But again, you have to kind of learn that through your own experience. Alright, also if you're interested, I have another YouTube channel called Light Vedic Astrology. If you're interested in Vedic astrology, you might check that out. Alright, so there you go, folks. Thank you for your time. And I really appreciate your interest, your support. Thank you to all the new subscribers. Let's keep it going. Alright, until the next one. Take care.